Okay, hello everyone. Thank you so much for joining us today. We're very excited that you're able to join us for the official launch of the Case for Inclusion Policy Blueprint. Um, my name is Tom Rice. I'm the Director of Policy and Regulatory Affairs for ANCOR. And once again, thank you for joining us. Uh, for almost 20 years now, the Case for Inclusion has offered comprehensive data to assess how effectively states are serving people with intellectual and developmental disabilities. Now, starting with the 2021 edition of the Case for Inclusion, we began pairing it with what we call a policy blueprint, which is really kind of a guide for federal and state government officials and lawmakers uh, that specifies actions that they could be taking to really strengthen community-based services for individuals with intellectual and developmental disabilities. Now, 2025 marks our first year that we're having a standalone edition of the Case for Inclusion Policy Blueprint, which again offers recommendations for policies that promote more sustainable services for people with intellectual and developmental disabilities. In terms of timing, it's really never been more important for policymakers to invest the time, focus, and funding into community-based services, particularly as we transition to a new administration and Congress. New opportunities arise for policymakers to bolster the direct support workforce and enhance access to community-based services for people with intellectual and developmental disabilities. So once again, thank you so much for joining us. Okay, just a little housekeeping first. Just to let everyone know, this webinar is being recorded and the recording will be shared with all of the registrants within 3 business days. If you have questions, we ask that you use the Q&A feature in the Zoom control panel to ask questions of any of the speakers that you hear from today. Also, please use the chat feature in Zoom in the Zoom control panel if you're having any technical difficulties whatsoever, and we've got folks looking at that, and they can assist. Closed captioning is also available. Just click on the little CC icon in the Zoom control panel to get closed captioning. We've got a lot to cover today. We're going to start out with some opening remarks from Gab Sidor, our ANCOR's Chief Operations Officer. Next, we'll provide an overview of the current state of community-based services. And then we're excited to host a panel discussion, Voices from the Field. You'll be able to hear directly from providers of supports to individuals with intellectual and developmental disabilities. Then we'll dive into the actual policy blueprint itself, along with those specific recommendations I talked about for policymakers. Lastly, we'll address some of the Q&A that we see coming through in the chat, and then we'll turn it over to Armando from UCP for some closing remarks. So at this point, I'd like to start with the opening remarks, and let me go ahead and turn it over to Gab. Gab?
Good afternoon, everyone. I'm Gabrielle Sidor, and as Tom said, I'm the Chief Operations Officer and Director of the ANCOR Foundation. And on behalf of ANCOR and our partners at UCP, I am honored to welcome you to this national launch webinar for the Case for Inclusion 2025. Here at ANCOR, we always love the opportunity to release Case for Inclusion because we know it's one of the resources that's incredibly valuable for our members, our policy champions here in Washington, and for countless advocates like you across the country. At the same time, I would be remiss not to acknowledge the gravity of the moment that we're in. Congress is currently considering legislation that could enact deep cuts to Medicaid. Recently, the House passed a budget resolution requiring at least $880 billion in cuts, the majority of which would have to come from Medicaid. If passed by the Senate, this legislation would have devastating consequences for people with disabilities and the provider network that supports them. This legislation comes at a time when our decades-long workforce crisis, though far from over, finally started seeing signs of meaningful progress. In 2023, we saw two huge milestones. First, albeit just slightly, we saw turnover ratios dip below 40% for the first time since the National Core Indicators began tracking this indicator more than 10 years ago. Second, also according to National Core Indicators, the median hourly wage for direct support professionals exceeded $17 per hour in 2023, a jump of nearly $1.25 over where it was in 2022. These promising signs were made possible, at least in part, thanks to temporary pandemic area funding allocations that have either expired already or are set to do so by the end of this month. Taken together, this outlook is nothing if not uncertain. But there is a reason why hope is not lost. That hope can be seen in the, dare I use the word, unprecedented advocacy that community providers like so many of you have engaged in since the start of 2025. In just the past 2 months alone, the advocacy of ANCOR members, which includes all 56 of UCP's North American affiliates, has resulted in over 75,000 messages sent to members of Congress, including nearly 12,000 advocates who reached out for the first time. Outreach to 393 House offices and 98 Senate offices on Capitol Hill in just a single week during our National Week of Action to Save Medicaid. Flying days on Capitol Hill, where more than a dozen provider organizations and state provider associations or other state delegations have come to Washington to connect with lawmakers in person about the value of home and community-based services. Nearly 24 op-eds and letters to the editor submitted to different media outlets, with placements starting to roll in from Alaska to Colorado to California to Missouri. Roughly 8,000 visits to the ANCOR amplifier, nearly 6,000 visits to our Medicaid Resource Center, and about 2,500 visits to our advocacy toolkit. Advocacy like this is precisely why we relish in the opportunity to co-present the case for inclusion each year. We know that community providers like you are fired up and ready to go on anything that might help strengthen the lives of people with intellectual and developmental disabilities by strengthening IDD services and the workforce that delivers them. Of course, we can do none of this alone. So I want to wrap up my remarks by extending ANCOR's immense gratitude to the amazing and growing team of professionals at United Cerebral Palsy. UCP's president and CEO, Armando Contreras, approached us in 2018 with the opportunity to begin collaborating on the case for inclusion, which UCP has been publishing on its own since 2006. My gratitude for that invitation is surpassed only by my gratitude that we were smart enough to accept the invitation. In particular, I want to thank you, Armando, as well as Sarah Piper and Kismet Saglum from your team for being such ideal partners on what is now our 7th Case for Inclusion collaboration. Last but not least, to everyone joining us today, thank you. Thank you for taking the time today, and more importantly, for the advocacy that you've been engaged in and will continue to engage in on behalf of people with IDD. Now, without further ado, it's my pleasure to reintroduce one of my newest colleagues, Tom Rice. Tom joined Team ANCOR in 2024 as our Director of Policy and Regulatory Affairs, following a 20-year tenure, serving in various roles with the state of Florida's Agency for Persons with Disabilities, most recently serving as APD's Deputy Director of Programs. Tom is also the lead author in the Case for Inclusion 2025 Policy Blueprint, which makes him the perfect person to walk us through this year's policy recommendations. Tom, floor is yours.
Thank you so much, Gab. I'm going to start sharing my screen again. Okay, before we get to the details of the policy blueprint itself, it's important to spend a few moments describing the status of our current system of supports for people with intellectual and developmental disabilities. Um, and in order to understand the rationale for our blueprint and the specific policy recommendations contained therein. So, direct support professionals, or DSPs for short, deliver crucial supports that enable people with disabilities to live full and independent lives in their homes and communities. When we speak about community inclusion, so much of the work that goes into making that a reality is performed by DSPs. Unfortunately, long-term underinvestment in home and community-based services, together with stagnant and insufficient reimbursement rates, have hampered the ability of community providers to offer DSPs competitive wages and benefits. This has led to an exodus of qualified workers from the field and, in turn, a declining access to quality services. The resulting DSP workforce crisis has had a profound impact on the ability of community providers to deliver essential programs and adequately support people with disabilities in their communities. Um, with staffing shortages of the magnitude described in previous editions of the Case for Inclusion, as well as ANCOR's Workforce Crisis Report, community providers are often forced to reject referrals or continue programs and services at an alarming rate. For example, as you can see on the slide here, 90% of community providers reported experiencing moderate to severe staffing challenges. Now, these staffing challenges have led to 69% of providers turning away new referrals and 32% discontinuing programs or services altogether. Additionally, more than half of case managers reported difficulties in connecting people with available services. The degree of staff turnover and vacancies has adversely impacted the ability of people with intellectual and developmental disabilities to find and access community-based services. At this point, Gab touched on it a little bit earlier, but I'd like to just take a little bit of time to provide an overview of what's happening right now in Congress related to Medicaid funding and its impact upon state budgets. After that, I'll turn it over to Lydia Dawson and our panel to talk more about Medicaid funding cuts and how they would impact the ability of community-based providers to continue supporting people with disabilities within their communities. So, um, where are we right now? So last month, the U.S. House of Representatives passed a budget framework calling for cuts of at least $880 billion to the Energy and Commerce Committee budget. Now, which is a part of the federal budget that includes Medicaid. According to the nonpartisan Congressional Budget Office, the Energy and Commerce Committee only oversees a combined $381 billion on programs outside of Medicaid, meaning that even if that committee terminated every single other program it oversees, 745 billion of the 880 billion in cuts would need to come from Medicaid. That's obviously a significant number. Even when Medicaid funding reductions don't specifically target community-based services for people with intellectual and developmental disabilities, the resulting pressure on state budgets creates an elevated risk of cuts in services to people with disabilities. So whenever federal Medicaid funding is reduced, states are forced to find new sources of funding to balance the shortfall and avoid any service reductions. Now, if states are unable to find new funding sources, optional services like community-based services for people with disabilities are likely to be reduced, leading to longer waiting lists for services and higher rates of unnecessary hospitalizations and institutionalizations. At this point, I'd like to turn it over to my colleague Lydia Dawson, Anchor's Vice President of Government Relations, who's going to, with our panel, explore the downstream impacts of Medicaid funding decisions upon people with intellectual and developmental disabilities and the community providers who support them. Lydia?
Thank you so much, Tom. Colleen and Cheryl, if you're available, if you wouldn't mind turning on your screens. It's so good to see you both. Thank you so much. My name is Lydia Dawson. I'm the Vice President of Government Relations for ANCOR, and I'm here today joined by two of my colleagues who have been so helpful in providing guidance and support for ANCOR and UCP's initiatives in supporting advocacy for community-based services for people with intellectual and developmental disabilities. I'd love to start out by just giving you both an opportunity to introduce yourselves to those who are watching today and tell us a little bit about the services that you offer. Colleen?
I'm Colleen Crispino. I'm the president and CEO of UCP of Long Island. We offer pretty much the full range of services from early intervention, school, residential programs, day programs, employment programs, some family support services. And so pretty much the whole gamut. We serve probably close to 1,000 people annually across all of those programs. And I'm happy to be here.
Cheryl?
Hello, good afternoon. I'm Cheryl Wicks with Mosaic. I'm Mosaic's Vice President of External Affairs. Mosaic is a national healthcare organization in 12 different states, primarily supporting people with intellectual and developmental disabilities. We support about 5,000 people across all 12 states with a workforce of 5,500. And in addition to providing services to those with IDD, we also provide some senior living or some in-home senior services, as well as supporting people with physical disabilities. Thank you for having me today.
Thank you so much. You know, Tom shared some pretty staggering statistics about what the workforce crisis looks like in services today, with 90% of providers reporting moderate to severe staffing shortages in the last year alone. I was hoping you could talk to us a little bit about how the direct support workforce crisis has impacted your ability to provide supports and services for people with intellectual and developmental disabilities.
Sure, I'll jump in, Cheryl, if you don't mind. For us, we've had serious issues with staffing. We have 30% less staff than we had 8 years ago. It comes out to about 100 FTEs of staffing, and we use largely temp agency staff to fill a lot of those gaps, which is not the best quality of services, but it is what we're forced to rely on because of the staffing shortage.
Yeah, we too are seeing some really significant issues. Our turnover is still around 50%, although it is higher in a couple different areas, but which is down from a couple years ago. So that's really been great. But it also is just the caliber of direct support professionals that we're able to bring on board right now. We definitely are noticing a difference in that. And then we too, just like Colleen, are having to invest more in hiring temp agencies to provide those services, especially for registered nurses in some of our waiver group home services, as well as our intermediate care facilities that we have.
With program development or your ability to take on more folks seeking services, we know there are so many people with intellectual and developmental disabilities with unmet needs that are seeking additional services or seeking support. How has the workforce crisis impacted your ability to take on new clients, to support additional people, or to develop new programs that may be able to expand out to serve more people?
Okay, I guess I'll start again. For us personally, it's really impacted our ability to provide day and employment services. Residential services, we figure it out, but our day and employment services are at about a 65% capacity since COVID. And the real reason for that is not because there are not people looking for day and employment services, it's because we don't have enough staff to actually bring them back into the building or to the to the work sites or wherever their services are provided. So for us, we have not looked to open new programs. I don't feel it's responsible, because even though there's, I think, a 15% increase in the number of people who are applying for services than there was 10 years ago, but we just don't have the capacity with staffing the way it is to actually provide good quality services to any additional people.
Yeah, in addition to what Colleen shared, we've really shifted some of our service model due to some of the issues that we've had with staffing for direct support professionals in more of those congregate settings. So we've been really spending a lot of time and energy looking at how can we also provide these services in a smaller, more intimate setting, such as the life sharing or host homes or shared living model. That has proven to be more successful for us being able to recruit people, and also has been able to help us not have to minimize any of the programs, although we have had to step back a little bit, specifically on day program. That is an area, as well as intermittent services, those hourly services that were offered. The rates just are so low in a lot of our states that it's very difficult to provide those services. And so really having to take a look at how are we providing those services and which ones are going to be the most beneficial so people have access to care.
Cheryl, I'd love to follow up on some of that. If what would you see as the root cause of the workforce crisis? Where are direct support professionals leaving to go, and what's really causing this exodus from the field?
Yeah, so a variety of things that come top of mind. For one, the pandemic, it really caused a lot of burnout for a lot of our direct support professionals. And so, we see that happening, but we also are seeing that we're not able to match the wages that other facilities are paying. And so in some of our locations, our biggest competitor might be a nursing home or an assisted living facility. Whereas in other areas, it could be going to more of your retail and restaurant business. And it's been very difficult in order to keep up with those wage increases. So, as McDonald's and some of the other places are going up to $20, $25 an hour, our average from last year was $16.34 an hour. I mean, that's $32,000 a year for a direct support professional, and so we're really limited based off of the Medicaid reimbursement rates that we're receiving, and we're sort of stuck. We philosophically really want to pay more, but it's really difficult to be able to pay more when our rates just don't cover the labor costs that we need to have.
Colleen, are you seeing those same sort of effects with DSPs leaving for higher paying jobs in like fast food and retail? And what do you see as that foundational issue?
I think it's very similar to what Cheryl said. 77% or so of our revenue comes from Medicaid. So we don't operate at a huge surplus. We don't have a lot of available funds to just give increases. And here in New York, where we are, minimum wage has been going up rapidly over the last 5 years, and we have been struggling to even keep pace. I mean, obviously you have to keep pace, but even struggling to keep pace with that. We used to be at about 150% of minimum wage probably a decade ago, and now we're barely above. In New York, we're fortunate. Our state made an investment this year that is helping us to move those up. But if we get to 10% above minimum wage, it will be a lot. And these are not minimum wage jobs. People don't want to do this work for minimum wage. And I am seeing job postings at McDonald's. I screenshotted one the other day for $23 an hour. And I don't know who wants to shower people and, feed people when they can, make French fries. So not that I'm demeaning making French fries, but this is really important work, and we need to pay people a wage that is equal to the work that they're doing.
So I'm hearing from you both that the state set reimbursement rates for these services are often the only source of funding for community-based support for people with IDD, and those reimbursement rates are set by the state. And if the state doesn't keep up with that, with the cost of service, with minimum wage, that can put services at a deficit and really compressing the ability to provide a competitive wage with these other industries competing for workers. And that reimbursement rate, as I understand it, is a state and federal partnership. So the funds will partly come from the states, but those state funds are also met with matching federal funds that create the federal and state Medicaid funding for the state that goes into how they set reimbursement rates. And Tom walked us through some of the things that we're seeing right now in Congress, that there's a House budget resolution on the table for consideration in the Senate that includes $880 billion in savings that Energy and Commerce that oversees Medicaid would need to find, the bulk of which would need to come from Medicaid. If we do see that type of a significant cut to federal Medicaid funding, how might that impact your services in the state? What do you see happening to services and access if we do see a cut like that?
I find it hard to imagine how that could even play out and our service system would survive, because I think we've been at a point between staffing and rates for such a long time that I don't think there's any agencies out there that have a tremendous amount of resources that will weather significant cuts to Medicaid. And I can't imagine if New York State, in my case, gets cuts to Medicaid, that somehow that will not trickle down to us. It will, and not just for my programs, the HCBS stuff, but also healthcare and the specialty clinics that a lot of people with disabilities rely on. They rely on their Medicaid rates also. So all of those things will impact the quality of life and the health and the well-being of people with disabilities all around the country.
It would be completely devastating. We've got states that Mosaic is in, one of which has a $2.6 billion state deficit for their budget. Another state has a $1 billion state deficit. So they're already having to make really tough decisions on the Medicaid program, which is optional in our states. But if you throw in a federal cut, it's going to be really difficult for states to find the extra funding. It will drastically decrease where we've been going and the momentum we have had with providing more community-based services. It will force people to go back into potentially more of those nursing home type settings, potentially, more of a state-run institution. Each state sort of has their own definition for how they state that. But and then it also is going to put so much more strain on just our social sector. So I'm thinking of, homelessness, in addition to more law enforcement. More people are going to be hospitalized because they will not have access to the care that they need. And then those are the people that we support. And then you think about the people that are living at home with an aging caregiver, and that number is very high depending on where you look at that data. And then what are they going to do as well? So it definitely would be devastating.
Thank you. You both touched on such a number of incredibly important points about how we would see this impact services, impact your programs. I'd love to just follow that one step further to the people who are receiving our support and folks that are waiting for services. You mentioned, Cheryl, that home and community-based services are an optional service, meaning that states could choose to deliver those programs or choose not to deliver those programs. If states experienced such a significant cut to federal funding, how might that impact waiting lists for services, and what does it mean when someone has to wait for decades or years to receive support through home and community-based settings?
Yeah, so right now I think there's over 500,000 people that we are aware of that are on waiting lists across the country. In one of our states, we have 16,000 people on the wait list, and that's the largest number we have. But if we start to if we have to make really tough decisions, and the states are making tough decisions on community-based services, that number is going to skyrocket, and it's going to go really high, because we won't have the access, we won't have the providers to choose from to be able to provide those services for people. And then for those that are on the wait list, just personally, I've experienced, a number of people who have been on the wait list for 20 years, 15 years in some states. And it's some people have passed away while they're waiting to get services. And it's just, they're not going to be able to get that support that they need for their whole person. They might be going to their primary care doctor, but if they need any specialty doctors, that might be harder for them to be able to access. So then they're not able to receive those supports. And that could be pretty detrimental to the health of that person in service, as well as to the caregivers.
Yeah, and I think I would agree with everything Cheryl said. The HCBS is in New York is the majority of how our services are provided. Almost everything in New York for people with intellectual and developmental disabilities is under the HCBS waiver. So the impacts to that would be huge. And we're seeing the same thing. We're seeing people wait a long time for all kinds of services, day, employment, residential. And as people are living longer, including the people we're supporting and other, kids are aging out of school programs. They're not finding their way into programs. They're sitting at home. So there's a whole other generation of people with disabilities who are, ending up with little to no quality of life because there's not just options for them out there, largely due to the staffing crisis, but that will get considerably worse if we were to see any additional cuts to Medicaid.
Thank you both so much. I see a number of questions in the chat, and so I hope you both are available to stick around for our Q&A portion. Really appreciate your insight here today and your thoughts for what we can do and where there are opportunities to strengthen the system. I'm going to turn it back over to my colleague, Tom Rice, to walk us through the recommendations of the report, and look forward to seeing you both again soon.
Thank you so much, Lydia, and also to Cheryl and Colleen for your insights and perspectives. Let me go ahead and let's go back to sharing. Hold on one second. Okay, Lydia, can you see my slideshow again?
I'm so sorry, Tom. I can't see it just yet, but please let me know if there's anything I can do.
Okay, hold on. Let me try one more different way.
Perfect. We can see it again. Thank you, Tom.
Okay, thank you. Okay, um, at this point, I'd like to dive right into our policy blueprint recommendations. And one of the things you'll notice is we've developed separate and distinct recommendations for the president, for Congress, for state governments, as well as for providers and advocates. Beginning with the Trump administration, we're recommending that the administration requires states to establish systems of access monitoring that compel regular reviews of Medicaid reimbursement rates to ensure that Medicaid payments stay current with increasing service delivery costs and safeguard access to quality home and community-based services. Next, we recommend the administration revise the standard occupational classification system to create a distinct classification for DSPs or direct support professionals, which does not currently exist. We believe that this will help all levels of government to identify employment trends and design appropriate policies to address the direct support workforce crisis. We're also recommending the administration should require interagency collaboration between the Department of Health and Human Services, Department of Labor, and other federal agencies to ensure that appropriate funding is in place prior to issuing any new regulations that would increase the cost of service delivery. The administration should require state and federal agencies to collect and publicly report on measures related to workforce volume, stability, and compensation, and its resulting impact upon access to services. Lastly, we urge the Trump administration to support and develop programs that meet the social needs of people with intellectual and developmental disabilities, as well as the direct support workforce, including housing and food security, to ensure better access to health care and that would promote economic independence. Our recommendations for Congress include seeking to increase the federal share of funding for Medicaid home and community-based services programs in order to stabilize the direct support workforce and ensure access to services. We recommend preserving existing community-based programs and current Medicaid funding for home and community-based services for people with IDD. We recommend the provision of increased funding for community providers to offset the increased expense of regulatory compliance. And finally, we urge Congress to invest in the training and professionalization of the workforce by establishing career pipeline programs for DSPs, which will support recruitment, retention, and advancement efforts. Now, state governments have an important role to play as well. First, we recommend that state governments apply for any and all federal funding opportunities that are focused on stabilizing the direct support workforce. We also recommend they establish systems of access monitoring that provide regular review of reimbursement rates to ensure that payments stay current with increasing service delivery costs and safeguard access to quality services. We'd like to see states encourage the Office of Management and Budget to establish that standard occupational classification for DSPs we just mentioned. We also encourage states to participate in the National Core Indicators Workforce Survey so that national policymakers can be made aware of the urgency and necessity of better supporting the workforce. In that same vein, we recommend that states collect and publicly report on measures and metrics related to workforce volume, stability, and compensation to identify and target gaps in access to care to avoid further harm to the home and community-based services infrastructure. Finally, providers and advocates should seek out and apply for state and federal funding opportunities which are intended to expand or strengthen community-based supports for people with intellectual and developmental disabilities. These stakeholders should urge their states to leverage federal funding opportunities to stabilize the direct support workforce by increasing reimbursement rates and creating review systems that ensure DSP wages can keep pace with rising labor costs wrought by inflation and increased demand for services. We recommend these groups seek out and take advantage of opportunities for stakeholder engagement and public comment on all matters related to home and community-based services, policies, laws, regulations, and funding decisions. We also recommend providers and advocates access the state-specific case for inclusion data to help in fueling your advocacy by visiting caseforinclusion.org. Additionally, we urge providers and advocates to take advantage of the available resources from both UCP and ANCOR at our respective websites, ucp.org and ANCOR.org. And finally, you should stay informed about one-click opportunities to take action using the Anchor Amplifier at amplifier.anchor.org. Before we wrap up today, I wanted to leave all of you with some recommendations that everyone can begin adopting today. First, as I said, please encourage everyone to visit our Case for Inclusion website at caseforinclusion.org to access the latest key findings report, as well as stories, data, and other resources to aid in your advocacy. Secondly, we'd ask you to lend your voice to our advocacy efforts using the Anchor Amplifier. Browse Anchor's Advocacy Toolkit, which contains tools to build your advocacy skills and take advantage of, as well as taking advantage of the action alerts we have developed. Coincidentally, today is the National Medicaid Day of Action, and we have a specific action alert designed for that purpose. Now, the action alerts are a really cool tool that you can access on the Anchor website, and it allows you to send email messages and access scripts for phone calls, etc. Just really very simple way to engage your lawmakers. And you just input a few pieces of information, and it will automatically identify who your representatives in Congress are, and then it just makes it very easy to lend your voice to those advocacy efforts. It's just very simple. Lastly, you can also connect with a UCP affiliate in your community at ucp.org to see how you can get involved at a local level. Now I'd like to turn it over to Armando Contreras, President and CEO of UCP, for some closing remarks. Oh, I am so sorry. I apologize. I skipped right over our Q&A feature. So Lydia, would you mind reviewing some of the questions that were posted in the chat?
Sure, I'm happy to. And if our panelists and all of our speakers wouldn't mind turning on their camera, I'll make sure to direct questions where we might have a speaker that can speak specifically to those points. Just starting with our Q&A, Tom, we had a question about that connection between the $880 billion in the instruction on the House budget resolution to energy and commerce, and how much of that would come from Medicaid funds specifically. And so I was hoping you could just repeat the CBO scoring and where we're seeing that connection specifically to Medicaid funds.
Yeah, exactly. And I believe the number the direction to the Energy and Commerce Committee was $880 billion. Now, that committee does oversee budgets and appropriations for other areas other than Medicaid, but it's not a huge amount. So as I said, even if the committee were to eliminate funding for every single other program under their kind of jurisdiction, which they would not do, it would still be there would still be hundreds of billions of dollars that would still need to be cut from Medicaid. I believe I had said it was about I think it was 700, a little over 700 billion, I believe. I don't have the actual number here.
745 billion. You can find all of these materials also, just letting folks know, at ANCOR's Medicaid Resource Center. So that's anchor.org/Medicaid. If you'd like to see the Congressional Budget Office's review of what's under the authority of Energy and Commerce, you can see those where this funding is specifically allocated and how we would need to find approximately 750 billion from Medicaid, even if Energy and Commerce terminated every single program that they oversee outside of Medicaid completely and netted those to zero. I wanted to address very quickly before our next question. There's a comment in the chat speaking to the importance of recommending that there are no cuts to Medicaid, because so much of the case for inclusion is looking at solutions to the workforce crisis, to stabilizing and strengthening services for people with intellectual and developmental disabilities. But as we have also discussed and heard from our panelists today, when we see that those types of cuts to Medicaid, we're only introducing new problems and devastating problems that have the opportunity to completely collapse the system, given how fragile it is to begin with. And so I was just going to offer, before getting to our next question, that the case for inclusion will always be a source of policy recommendations about how we can strengthen and stabilize the system. And of course, that means we need to invest in Medicaid and not divest from Medicaid. And so first, we must absolutely reject cuts to Medicaid, which will only make the problems worse, and then look to the case for inclusion for solutions about how we can make the system better. I saw a question in the chat that spoke specifically to the importance of including the DSP workforce as part of the standard occupational classification. And while we didn't see the bill that we referred to in the last case for inclusion come to fruition in the last Congress, we have seen this administration take steps to revise the occupational classification code and requested specifically for public input on creating new classifications of direct care workers. So we know that the administration is listening, that they're considering this particular classification, and we hope to see those steps come next. And I turn to our panelists, Cheryl and Colleen, if you could talk a little bit about the importance of a standard occupational classification for direct support professionals.
Well, I think primarily it professionalizes, the role of a direct service professional, and it keeps focus on a state level and a national level on what kind of work they're actually doing and what the value of that work is. So I think that is, that's the critical issue and why this has been a push for so many years at this point.
I agree wholeheartedly with what Colleen said.
And if I could stay with you both for just a moment, I see a question also in the chat that is talking about what's happening to compound the problems that we're seeing with the workforce crisis, while we're still seeing policy changes that increase service provider requirements and staff qualifications. And the comments speak specifically to value-based compensation models, and how. So I was hoping that you could talk a little bit about administrative requirements or new policies that don't come with reimbursement rates, and how that may impact the system while we're undergoing a workforce crisis.
Yeah, so there's been a number of things that have happened administratively. Last year, we saw a flurry of final rules, of which some of them the Trump administration is assessing now to see if that's going to be repealed. But as we look at those and think about even the final settings rule and other requirements that we have, it's all of this new administrative overhead for tracking and trending, and it could be a duplicate of systems that we already have. For example, reviewing quality systems and tracking and trending of your quality initiatives that you have internally that are required through regulations and through final rule. We might have our own internal system, but then because we're in 12 different states, each state will have their own extra system that they want you to use, and it does not create efficiency. But that's just one example of a number of things that are being pushed out and being really looked at and potentially implemented in the next couple of years that are going to be a significant burden, not only on us as an organization, but also on our state governments as well.
And I see just a couple of other questions looking at those kind of cuts and what that might mean on the ground. I see a question that says if individual and HCBS services get cut and states choose to utilize more of a facility-based services, essentially, how can they do that when we have things like the settings rule in place that urges us to look for more community-based settings, integrated settings, smaller homes for folks. And I think that remains kind of an open question. If we do turn to more congregate settings or state-run institutions, more facility-based for folks that can remain in their homes and communities if given the appropriate support, the state risks a lot. There are federal laws in place, including the Americans with Disabilities Act, alongside many of these regulations that put the onus on the state to provide that integrated setting for folks that could benefit from being there. So not only would they be at risk for some of the things that our panel spoke to today about having increased unmet needs that rise to crisis levels that may force people to seek emergency services or may be forced into institutions because they can't find support in the communities. But also our states run a risk of violating federal laws in order to try to balance the type of shortfalls that we could potentially see in state budgets. Looking at just last to the chat and to the Q&A, there's a question that says, are you seeing that the $880 billion over 10 years has any focus on home and community-based services or some other area, and then gave an example like Medicaid expansion? And ultimately, as Congress considers these cuts to federal funding, they're looking at they're looking at cuts to federal funding that would be passed to states, so that they aren't able to target it to a specific population necessarily, but simply to the amount of funding that goes to states. And so, I would turn for some final thoughts from our panelists. If your state experiences a significant shortfall in federal funding, whether that's a shortfall that came from reduction in federal funding to expansion populations or reduction in federal funding as like a reduction in federal matches or in block grants or per capita caps, however your state may experience or however it may come that your state experiences a significant shortfall, does that mean that there isn't a risk to home and community-based services, or how might you see that play out?
Well, I think there definitely would be a risk to home and community-based services. I think that we are, high users of Medicaid dollars, New York itself, but also our IDD system. And I can't imagine that they could deal with these kind of cuts without impacting all services. And HCBS for people with IDD is a big piece of the puzzle here in New York.
Yeah, I mean, Medicaid's the largest funding component of all state budgets. And so just to Colleen's point, to reemphasize that, we really do at this time have to pay attention to all the things that they are looking at, though, because on surface, it might look like, oh, Medicaid expansion, maybe that necessarily might not impact us because of how we're being funded through Medicaid, but it's going to have a downstream effect on our workforce, and it's going to be very, very significant, where workers might not be able to afford their health plans that they have, or organizations might not be able to provide the health plans that they provide at a low cost to their workforce. But also in a recent article from KFF, they really outlined and talked about the impact of if the FMAP was removed from states, and what would that look like? Well, it would be over the course of 10 years, a $1.9 trillion reduction for the states, as well as then 20 million people would not be able to have access to services potentially. And so those are the things that we really have to pay attention to, that as they're having those discussions on those items, as well as a variety of others.
Thank you so much. I'm seeing so many comments in the chat just underscoring the harm of Medicaid cuts in this way to the systems that support people with intellectual and developmental disabilities. Thank you so much to our panelists here today, and thank you to all of our speakers. Armando, I would love to turn to you.
Thanks, Lydia. As we wrap up today's discussion, I want to take a moment to express my heartfelt gratitude for this incredible partnership with UCP and ANCOR. A special thanks to Barbara Merle, President and CEO of ANCOR, for her steadfast leadership during these challenging times, but a continued engagement with UCP and with the disability community. Barbara, your dedication to the disability community inspires all of us. I also want to recognize Gabrielle Sidor, Tom Rice, Lydia Dawson, Sean Luchtefeld from Team ANCOR. Your collaboration made these Case for Inclusion reports possible throughout the years. ANCOR's partnership with the Case for Inclusion reports these past 7 years have been much appreciated and very impactful. I also want to express my sincere gratitude to Sarah Piper, Kismet Salam on my team, the steering committee, and the UCP policy committee for their efforts during the Blueprint report draft review process. To our panelists, Colleen Crispino, President and CEO of UCP of Long Island, and Cheryl Wicks, Associate Vice President of Government Relations at Mosaic, thank you for your invaluable contributions. Your real stories, data, and urgency for change have brought these critical workforce and rate issues to life. Your insight reminds us why state and federal policymakers must prioritize investments in community-based services, our direct service professionals, which we know are the lifelines for so many individuals with IDD and their families. A huge thank you to everyone who contributed to making this event so insightful and thought-provoking. Your hard work, passion, and expertise have created something truly impactful. The Case for Inclusion report has always been more than just data. It's a call to action. Over the years, it has delivered actionable policy blueprints to spark meaningful conversations about how we can better support individuals with cerebral palsy and intellectual and developmental disabilities. The 2025 policy blueprint builds on that legacy, offering bold, practical solutions for the challenges we face today. Today, we tackled pressing topics from workforce challenges and the value of HCBS services to creating opportunities for people with disabilities to thrive in their communities. Now more than ever, we need your advocacy and commitment of collaboration to address all of this for the road ahead. I encourage all of you to take these important discussions back to your organizations, community, and networks. Together, we can build a brighter future, not just for individuals with disabilities, but for society as a whole. Finally, know that UCP and ANCOR remain deeply committed to advocating at the highest levels of government to protect Medicaid, champion direct support professionals, advocate for service providers, and provide a voice for the disability community. With that said, thank you for your time, your passion, and expertise. Let's keep pushing forward and making a difference together. Have a great day. Bye-bye.